And now is the time for me to be more specific. As governor, I will ask the legislature to take the following action. First of all, to fund the private option this fiscal year and continue it through December 31, 2016. This avoids harm to the 200,000 plus on the private option, and it assures our hospitals and providers of financial stability. Secondly, I ask in the legislature to create a health reform task force that will make recommendations for the future. And the purpose of this task force is to find an alternative health coverage model to ensure health care services for vulnerable populations currently covered by the private option. So hear me clearly. We're going to continue the private option through 2016, create a health reform task force that will make recommendations for the future, and that will include a compassionate and reasonable and cost-effective response for care of those that are currently on the private option. The task force should also be charged with exploring and recommending to the legislature options to modernize the entire Medicaid program currently serving the indigent, aged, and disabled. Guidelines should govern any task force. And the guidelines I would suggest to the legislature should include, among others that they very well may add, and that is to minimize or eliminate the need for the state to raise additional general revenues for continued investment in this. Obviously, you have to keep up with inflation, but you want to minimize or eliminate the need for the state to raise additional general revenue for those purposes. Secondly, more federal flexibility in managing the state Medicaid program. Flexibility is critical. We fought for that. We want to continue to fight for that, including consideration of block grant type waivers or authority so that we can have the maximum amount of flexibility in Arkansas. And then to strengthen the employer-sponsored health insurance market, to increase employment of healthy recipients of taxpayer-funded health care services, to encourage the work as they receive that benefit for the working poor, to increase accountability and personal responsibility for healthy behavior of beneficiaries, and finally, to provide access to health services in rural areas of the state. These are some of the guidelines that should govern the task force that will go to work. The timing of this task force is urgent, it is important, it is critical, and it's got to move quickly, although thoughtfully and comprehensively. A report will be required by this task force by the end of 2015. They go to work by the end of 2015. We've got to have some answers back and some recommendations, because we need to allow time for legislative action so that we will have clear direction for our hospitals, our providers, and those that are currently covered for the future. And that would be to allow time to request necessary waivers and approvals from the federal government as well, so that we can have our solutions in place by December 31, 2016. I will further direct the Department of Human Services to immediately begin a formal assessment of the opportunities available to reform our Medicaid services to better serve our high-cost, high-need populations. And secondly, to utilize private sector expertise to identify and prevent waste, fraud, and abuse in our Medicaid services. This information that will be developed on the executive side through Department of Human Services will be beneficial to the legislatively driven task force. Data will drive solutions. Now let me emphasize to everyone here and that's listening that in regard to the private option, it is time to close this chapter and to start a new one. It is a new day for health care in Arkansas, and I pledge to work with you to find the right solution for all Arkansas. And while we are turning the page and beginning a new effort, our innovative efforts in Medicaid reform will continue. And by that time, December 31, 2016, we will have the recommendations of the task force. we will have a plan in place that assures a continuity in health care that is right for Arkansas and a plan that we can afford.